Hi guys, my name is Dr. PKJ, and in this video we'll be discussing a clinical vignette that's based on the PARC 3-step test. Basically, I asked a clinical question on the Telegram channels, and only 33-34% of you got this right. A majority of you got this wrong. And because PARC 3-step test is a bit complicated topic, and especially when you have the time and pressure constraints in the exams, it becomes a bit tricky to work the correct muscle out. So I thought I would make a video to understand the concepts behind the PARC 3-step test, and also at the end of the video I'll give you a cheat code when in the exam, if you're not able to apply yourself and all the concepts go out of the window, then at least you would have a trick to remember what is the correct muscle involved. So let's get started. So in this question, a patient presents to us with a head tilt towards the right side. On examination, he is having a left hypertropia, which increases on looking towards the right side or medially. So basically the hypertropia increases on the right gaze, and they are asking you which muscle is the most likely paralyzed muscle, correct? So this is a classic step, the PARC 3-step question, and you need 3 pieces of information in the question for you to be able to identify the muscle. The first is whether it's a right or left hypertropia. The second, whether the hypertropia or diplopia, whether it increases in the right or left gaze. And third, whether the hypertropia or diplopia increases in the right or left head tilt. So all those 3 information points are provided in the question. So let's see how to work this out. Now, the easiest way to solve a PARC 3-step question is first you make an edge diagram. This is called the edge diagram method, right? In this case, what we have here is the right eye and the left eye, right? And there are 8 muscles which are acting, right? There are 8 possible muscles in a case of vertical diplopia. This is an important point because the lateral and medial rectus, they only abduct and adduct the eye, right? They only are responsible for horizontal movements. So they have no role to play in a vertical diplopia. So the remaining 8 muscles, which is superior rectus, inferior rectus, superior oblique, inferior oblique of the right eye and the left eye. So you've got 4 and 4 muscles in both eyes that can be responsible for a vertical diplopia because these are muscles responsible for vertical movements. So the first thing is to draw an edge diagram and label the muscles based on what their actions are. Now this step is important because if you label the muscle actions incorrectly, then that's like the most rookie mistake you can make. There's no point of then it's obviously you're going to get a wrong answer, right? So first you need to get the edge diagram perfect. Now remember that let's say you've got the right eye and it's moving towards the right side. Let's say it's looking on the right side. So for the right eye, the right gaze is abduction, correct? And looking nasally is adduction, right? So the muscle which takes the right eye superiorly in abduction and inferiorly in abduction, these are going to be the recti, okay? So this one is your superior rectus, this one is your inferior rectus, correct? Basically remember this, the recti are adductors of the eye, but their maximum vertical action occurs in abduction. So you've got superior rectus, which is causing elevation and abduction, and you've got inferior rectus, which is causing depression, correct? Now, the obliques are abductors of the eye, but their maximum vertical action occurs in adduction. So here you've got the superior oblique, which is going to pull the eye downwards in an adducted state, and here you've got the inferior oblique, which is going to put the eye, which is going to elevate the eye in the adducted state, right? Go ahead and fill the same actions for the left eye too. So you've got inferior oblique here, superior oblique, inferior rectus, and superior rectus, correct? So once you know the edge diagram, then we have to process the information in the question to identify which of these muscles will be responsible. So like I told you, we need 3 pieces of information that need to be provided in the question, and let's see what the question tells us here. This patient has a right head tilt, he has a left hypertropia, and the hypertropia is increasing in right gaze, correct? So the first point is left hypertropia. The second point is it's worse in right gaze, correct? The third point, however, is that the patient has a compensatory head tilt to the right. Now this is an important point here, right? For Park step test, 3-step test, the question we need to ask is whether the hypertropia or the diplopia is worse in right or left gaze, correct? We don't have to interpret the head tilt into the equation. Basically, if the patient has a right head tilt, right, he is keeping his head tilted to the right side. Why? Because he's reducing his diplopia in the right head tilt. So his diplopia is going to be worse in the left head tilt. So we need to use that information in the edge diagram, correct? So in this case, you've got a right head tilt. That basically means his diplopia is worse in the left head tilt, right? So let's go ahead and see how these informational points are used in the edge. So now we know that the left eye is hypertropic, correct? That means the left eye is on a higher level compared to the right eye, correct? What that means is that either the depressors of the left eye are weak or paralytic, or the elevators of the right eye are weak or paralytic, correct? So in this case, for the left eye, the superior oblique and the inferior rectus, these are the depressors of the left eye, which could be paralytic, which is causing the left hypertropia, right? On the other hand, for the right eye, the elevators in superior rectus and inferior oblique could be paralytic. So that's causing the right eye to be slightly downwards compared to the left eye. Okay? That's the first piece. Now the second point is that the hypertropia or diplopia is worse in the right gaze. Now, if you look at the right gaze, the right eye goes into an abduction and the left eye goes in an adduction, correct? So basically, in right gaze, right eye is in abduction, left eye is in adduction. So which are the muscles that act in the abduction in the right eye? They are the recti. So you can have either the superior rectus or the inferior rectus responsible for point number 2 in the right eye. On the other hand, in the left eye, which are the muscles that act in the adducted position? They are the obliques. So you've got superior oblique and inferior oblique, which can be responsible for point number 2. A simple way to remember this point is that whatever position or whatever gaze is worse, you basically highlight the muscles on that side, right? So for example, right gaze is worse, so we highlight the muscles here, and if left gaze is worse, we highlight the muscles here, right? That's a very simple way to remember this point. Now the third point is the head tilt. To understand the head tilt, we need to understand what goes on the eye during a tilting process, right? So let's say these are your two eyes and there is a left tilt, okay? So if there is a left tilt, to maintain the horizontal equilibrium, the left eye is going to go into an intorsion and the right eye is going to go into a extorsion, right? Left eye goes in an intorsion, right eye goes in an extorsion. That is what happens normally. So if the diplopia is worse on left tilt, what it means is that the left intorters are not acting properly or the right extorters are not acting properly. So once you know that, in the left eye, what are the intorters? Remember the mnemonic SOSRI, sorcery. So superior oblique and superior rectus are the intorters. In the left eye, in the same side of the tilt, the intorters are acting. So if it's worse on left tilt, the left intorters are weak, right? So which is why the third point we highlight superior oblique and superior rectus. And in the right eye, the extorters are weak. So we highlight the extorters, which is inferior oblique and inferior rectus in the opposite eye. So once you use this information, what you are going to get is a triangle in one eye, right? And you're going to get something like an angle in the other eye. Not a complete triangle, but just XY axis and a angle, something like that, right? So wherever this happens, wherever the angle occurs, that is your affected eye, right? And the point at which all these three lines meet is your affected muscle. So in this case, you can see that superior oblique has been highlighted thrice, whereas inferior oblique has been highlighted only once, superior rectus has been highlighted only once, inferior rectus has been highlighted only once. On the other hand, in the right eye, inferior oblique has been highlighted twice, superior rectus twice, inferior rectus twice. Only superior oblique is the one that is highlighted thrice, and so in this case, your answer is left superior oblique weakness is going to be responsible for a left hypertropia that is worse in right case and worse on left tilt, and so the patient has a compensatory right head tilt. So when you have solved this answer and you've got the answer, it's important to doubly check and cross check and be sure that your answer is correct. So there are two tricks to be sure. First, that if you're making the edge diagram, you should be getting a triangle in one eye and an angle in the other eye. If you are getting two triangles in both eyes or two angles in both eyes, then you are somewhere wrong. So you need to go back again and look at the question, look at how you're doing the edge diagram, is it correct or not. Secondly, always remember that the eye in which you're getting the angle is your affected eye, and the muscle that's responsible is the one at which the three lines intersect. Now, in addition, if you happen to get the answer as superior oblique palsy, you can use two mnemonics to cross-check your answer, right? So basically the mnemonics are boot and vook. So in superior oblique palsy, the diplopia or the hypertropia is going to be better on opposite tilt, right? So BOOT, and it is going to be worse on opposite gaze, right? So our patient basically had a diplopia which was worse on right gaze and it was worse on left tilt. So he was keeping a compensatory right tilt, right? So the rules, the voog and boot also are in accordance with the answer that we got. So that's again a cross-checking mechanism that you must, if you get the answer as superior oblique, use these two rules and just cross-check your answer. So I hope that you guys understood everything that was the mechanism behind the Parkes 3-step test. However, in the exam, it's often not difficult to think so much, and it becomes a bit confusing. So I've given, like I told you, I would give you a cheat code to basically remember what kind of muscles you need to highlight. So even without thinking about the muscle actions and all, you are able to in 30-45 seconds arrive at the answer in case of a Parkes 3-step test question, right? So basically, if there is a right hypertropia, you will be highlighting these two pairs. If there is a right gaze, you'll be highlighting the muscles on the right side, and if there's a left case, you'll be highlighting the muscles on the left side, right? If there is a right tilt, you'll be highlighting the it's basically, it looks like a V, right? So these two pairs of muscles in a right tilt and these two pair of muscles in the left tilt. Again, this is not very conceptual, but this is just a visual representation of what your edge diagram would look like. Let me know in the comments below if this video was helpful, or if you have any more doubts, I'll be happy to answer them. Thank you for watching.